Ladies and gentlemen, I'm joined by Abby Bishop and Tessa Burrell from the Kent County Health Department. We're talking two very, very important things that they like to stress at the health department. Ladies, thank you once again for joining me. How are you?
I'm good.
Great.
How are you?
It's good to have you. Good to see you. I know everybody's busy as a bee. Life, you're looking back year to year. Do you feel like it's adjusting at an appropriate level so that you can focus on the things that other than COVID?
I think getting into 2023, the beginning of the year, now we're kind of getting adjusted to everything that has happened over the past couple of years with the pandemic, but it's taken a while.
It's been trying for you guys, hasn't it?
Yes, it has.
You've had to do all these adjustments on the fly, something that I don't think there's a rule book or a playbook for any of that. So
No.
Kudos to you for getting through that. Okay, let's start with Tessa. Fluoride varnish. That sounds like, not everybody knows what's up with that. Can you explain what's going on with fluoride varnish?
Yes. So back in 2018, we implemented the fluoride varnish program for all of our WIC kids. So if you're enrolled in WIC in Kent County, we offer free fluoride varnish to all of the kids. As soon as they have a tooth popping through within the WIC appointment, we will put the fluoride varnish on. It just has a little toothbrush and you put it in the little paste and put it on their teeth. And that helps prevent cavities. But also if they have cavities already forming, they can help slow the progress. So it's really important because a lot of the families that we see, they don't necessarily get their kids into the dentist young. A lot of families don't know, including myself. I didn't know you could take your 1-year-old to the dentist. And so our goal at WIC is to do a referral to dentists. But if they can't get into the dentist, then we offer the fluoride varnish within the appointment.
Well, that's exactly right. And some young people are susceptible to cavities. And if you have a baby tooth like that wants to leave the mouth early because of any type of decay, then you're looking at a pulpectomy and, silver tooth in there to replace it. And, sometimes that can be tough. So that's really good. I didn't even know that was a thing. Is that relatively new technology, I guess, fluoride varnish, or has that been around for a long time?
It's been around for a while. A lot of times the dentists and actually some pediatricians will apply it during your visit to the dentist, but we're seeing such young kids in the WIC clinic that they haven't yet even seen a dentist. So we see some kids who are 4.5 and they've never been to the dentist. So by the time we see them, and if they're drinking excessive amounts of milk or drinking a lot of juice or eating a lot of snacks through the day, and parents are keeping up with brushing their teeth, then we see kids with pretty bad decayed teeth, which then kind of self-confidence isn't there. The kids aren't smiling. The kids can't focus on learning because their teeth hurt. They can't eat certain foods. So it kind of gets them just in a position where they're not eating and acting like they should.
Very good. What about what was I going to say? Oh, okay. Fluoride varnish. Where was I? I was going to go somewhere with this. Holy cow. I swear. Oh, do people sometimes wonder if there's any side effects to this, or are there any side effects to this? Because that's, what a lot of parents always want to be extra careful about when it comes to introducing their kids to various things for their care.
Yep. Yes, so no side effects. And I know that, the city water has fluoride in it, and that got implemented in 1945 for Grand Rapids area. The only thing is once we apply it in the office, the kid can't eat anything hot or cold for about 30 minutes because we want the paste to get on there. So sometimes we will see families, they're coming from an appointment, their kids are hungry and they're like, you know what, I need them to eat a snack. So we'll just encourage them to do that during the appointment, and then we'll do the fluoride at the end. But that's the biggest thing. And then you don't want to brush their teeth for the entire day after that, so that the fluoride can get on there and kind of make a coating on their teeth. And then we can reapply it every 3 to 6 months.
People that are interested should just reach out, go to accesskent.com/health. And then is it part of the WIC tab that they would look at?
Yes. Yep. And they'll see it right there. And then if you're a part of the WIC program, we are asking every client if they're interested. If they're already seeing a dentist and already getting it done, that's great. And we just won't provide that service.
Okay, let's transition over to Abby. So this is all part of WIC qualification as well. These are families who, if they qualify for the WIC program, they'll be able to utilize that as well. And so, this is all part of what we've been stressing for some time. If you're having trouble making ends meet, keeping food on the table, the families need to stay fed, and it shouldn't be an option to go hungry. Can you talk a little bit about that?
Yeah, so like Tessa mentioned, fluoride varnish we provide it for our WIC participants specifically, but of course it's not the only thing that WIC is providing. So like you mentioned, times are tough, budgets are tight. And so WIC can give a little relief to that as far as supplemental food. So we offer food packages for infants, so formula, baby food, baby cereal, and then children 1 to 5. You're looking at peanut butter, eggs, bread, tortillas, yogurt, milk, fruits and vegetable money, which can be frozen, canned, or fresh fruits and vegetables if storage or prep is a barrier to getting those fruits and vegetables in. Frozen is a nice option for that. But then, of course, we offer the nutrition education. So helping families take the supplemental food and kind of stretch their dollar, stretch what they can purchase to kind of make the food last, and recipes, snack ideas. We just go over nutrition education for families. And then, referrals is a huge part of what we do. So dental referrals is probably one of the number one referrals that we make, which fits nicely with the fluoride varnish. So if a family doesn't have a dental office or doesn't know if their insurance covers dentists, we can offer that support in a list for them, as well as healthcare providers, community resources, connecting them with some of those hubs in Kent County that can navigate and case manage some resources for families. So there is a lot of benefit. You qualify income wise. If you're already on Medicaid or you're already receiving food stamps or SNAP benefits, you would automatically qualify for the WIC program. But if you're not on either of those programs, you can just give us a call at 616-632-7200. And we can kind of go over the income guidelines with you, as long as you live in the state of Michigan. And you meet those income guidelines and you're of one of the categories we serve, we can get you added to the program to receive some of those additional benefits.
Each month, does the family have to establish that they still qualify?
No, actually. So certification is determined about every 12 months, depending on your particular certification range or certification timeframe. So families are required to touch base with us every 3 months. So it's a quarterly touch base. And then in 12 months or when that certification is over, we will check income again and make sure you're still eligible for the program.
Okay. So these people utilize the food that is available for them. And if I'm understanding, it's a card, almost like a debit card.
Yep. So it's like it's an EBT card. It says WIC on it. It's a red card. And it works similar to like a kind of a debit system. So on your card for the month, we would load a specific set of benefits that are specific to your category or your eligibility on the program. So that might be 1 gallon of eggs, 1 pound of whole grain, 1 jar of peanut butter. And then as you spend that or you buy a jar of peanut butter that month, it just takes that jar of peanut butter off your balance. And then in the next month it reloads.
This is all great. Of course, the website, accesskent.com/health. Is there anything else that you guys want to touch on that might be important for all of this? Things that might make it easier for them. Is it, I guess my question is, do you encounter, what's the biggest roadblock from keeping people from doing this? Is it lack of information? They don't know, or sometimes people are shy?
I think there is maybe some lack of information, or sometimes because we require regular appointments, sometimes that can be overwhelming, especially if you have multiple people in the family on different schedules. You're asking you to come into the WIC office every couple months. So but we still encourage families to give us a call. We try to get, families on the same schedule, so they're not coming in all the time, and trying to make it as simple and as user-friendly as we can.
Tessa, is the fluoride free for folks if they qualify?
Yes.
Okay. So that's all part of it too.
Mm-hmm. Yep.
Okay. Well, I think you guys have covered it. accesskent.com/health. And you said 616-632-7200. Did I get that right?
That's correct. Yep.
Okay. Ladies, in closing, is there anything you want to wrap up with, or
No.
anything at all? Okay. Well, my best to everybody there. You guys are great. And if someone listening or watching this You may not need this, but you might know someone who does. So just keep it in mind, because your brain you might know 10 people. So I kind of throw that reminder out there, just like, hey, you might know someone in your neighborhood, your community, or your network who might need something like this. So keep the Kent County Health Department in mind. And of course, the county where you may live in, if you don't live in Kent County, these are things that are available all across the land. So Tessa, Abby, I appreciate you guys once again, and you do amazing work over there at the Kent County Health Department. Thank you so much.
Thank you.
Yeah, thanks.
Okay, bye, ladies. Bye-bye.
All right. Bye-bye.